welcome. My name is Raj. I'm the treasurer for AWA Queensland. And we got a few people on the internet also, or the web. Hi to them. And we got a very interesting topic from a professor here, Connie Chairugan. I think it's a very interesting combination of the topic that she's going to go through. And I've got a big list of what she is, but to keep it very short and interesting. Dr. Connie is a planetary health research practitioner in the School of Medicine and Dentistry from Griffith. And she's going to talk to us about how healthcare and the climate change and how she's going to do the hospitals and the healthcare to be better and combine it with the climate change. Am I right, doctor?
Kind of.
Kind of. We were to talk about it. But the interesting thing about Connie is, she was selected as one of the 15-member career professional in the Indo-Pacific Cooperation Network launched by AWA and the Japan Foundation. So she's one of them who got into that. And she's seriously traveled around the Indo-Pacific region, including Japan, Australia, Fiji, and Tonga in the last few years. And the focus is on strengthening ties among practitioners, scholars, community members, and various sectors across the region. So that's a big job. And the other interesting thing is she's consulted with WHO, and she's contributed to the development of health emergency and disaster risk management. It's a mouthful. So, and the other interesting thing is, and as the Asia Pacific focal point of the Women Leaders for Planetary Health Network, co-lead HEAL Observatory Knowledge Exchange, she's done a lot of contributions to action on climate change in healthcare. And be careful, she's also a good boxer and a karate trainer. So I'll just welcome Dr. Connie to come and tell us about it.
I haven't done anything, but I get a clap. So I was told this is a very kind, friendly audience. So I'll just push this magic button for the next slide. Here. Okay. Thank you so much for having me and sharing your time with me today. And this beautiful space for this very important, hopefully it's more hopeful message or conversation. So big shout out and thank you appreciation for the AWIA, Graham and also Ingrid for hooking me up with this gig, and also Ben for organizing and promoting this event. So we are gathering on the land of the Turrbal and Jagera peoples who are the traditional custodian of the land. And I pay my respects to the elders past, and also extends my respects to all the Aboriginal and Torres Strait Islanders peoples here today. So today, these lands have always been places of learning, teaching, research, and collaborations. As a new settler in Brisbane or in Australia, I am committed to learning of all the Aboriginal wisdoms and leadership which bring all of us together and help us understand and nurture the relationship with the ecosystem. So this is the acknowledgement, and today with all these different keywords that combined together as a topic or title of this presentation, today's presentation is a little bit combination of my professional learning and also my personal reflections. As I grapple what I'm going to say today with all the projects that I'm working, I want to give voices for all of them so that everyone could hear all this amazing attempt and work that is happening all around the world. But it's so hard for me to just squeeze into these 30 minutes. So for me, I was trying to just boil it down into two messages I was maybe trying to attempt to bring to you and share with you. So the first one, if you're not familiar with climate change or you're not familiar with climate change and health, hopefully this is the message that you'll bring home today. So what is good for addressing climate change is also good for health and also healthcare. So today I'll bring you some examples to illustrate that. And the second one is the concept of the enemy is out there syndrome versus Ubuntu, translated from a South African language, I am because we are. So in my line of work, I work a lot with hospitals and healthcare. This is the picture that I first and always share with them to give them a visualization that climate change is not about polar bear that is happening far, far away from us. It's literally at our doorstep. Although today we are in a cool winter weather, But around the world, there's a lot of impacts of climate change is already visible and felt in a lot of communities. So this is just the two messages I'm trying to do today. So first, can we maybe invite you to do a little exercise? Can I have your thumbs up, please? Any thumb, right or left? And point your thumb towards the ceiling. Go up and up and up, okay? So the virtual audience, please, you could also play along if you want to. Okay, so you're going to use your thumb and draw circles clockwise. Then look at your thumb and draw a clockwise circle. Continue doing it. It's fast and slow. It's okay. Don't worry. Okay. Good.
Clockwise.
Clockwise. Am I doing
You're again clockwise.
Clockwise. Looking at your thumb, clockwise. Okay. So after doing it, you could slowly move your thumb down to your eye level. Continue just doing clockwise, making sure it's clockwise. Double checking if it's a clockwise. Okay, go down to your waist level. Continue doing it as a clockwise. What do you see now? What direction is it?
Still in clockwise.
Is it? When you do clockwise here,
And you go down.
when you go down, what direction?
It's
Counter-clockwise?
Yeah.
Okay. So in the context of addressing this global issue, climate change is a global issue, okay? Oftentimes this perspective is we know, we don't have a plan B, a lot of impacts going on. There's two contrasting mindset emerge. So the message that I was saying, the enemy is out there syndrome, and opposite the philosophy of Ubuntu. So the enemy is out there syndrome is a mindset where individual or groups tends to be the place to blame problems and external entities. So it's not my fault, it's your fault. So you're the one, the fossil fuel company, the people who are emitting a lot of emissions, the high-income countries, the developed countries. And be the other people, nation, organization, while considering themselves separate from the issue. So we are not part of the issue. You are part of it. You are making me suffer. You are making those impact. So this perspective actually fosters very much divisions and hampers a lot of collaborative efforts. But on the other hand, which I would like to advocate, is Ubuntu. So these terms are coming from a Southern African embodies the philosophy that our humanity is interconnected. So the system is still the same, right? It's still doing the same. It's just perspective different. This philosophy translates to I am because we are, embrace and recognize that we are all part of a larger system. And our actions impact each other and the world around us. So when you do this exercise, what actually happened?
The direction changed as we went down.
Kind of, right? It's the same.
Perspective changes.
Perspective changes. So what was your initial reaction when you noticed that?
Surprised.
Surprised. Then what does this have to do with climate change? So up here, when we are looking at the clockwise directions, represents country with heavy emissions and their perspective on climate change. And down here, the counterclockwise represent countries contributing to climate debates with adaptation messages. Up here, scientists concluded that we must reduce carbon emissions immediately. Down here, we're thinking, oh, we don't have anything that we can do because the problem is too big, too complex, and maybe the technology can help us save the day and reverse all the impact of climate change. So the structure of climate change is still the same. The difference is only the level of perspective at which we are looking at the system. So understanding the positions that we stand is very important in this issue. So earlier on, you were asking me, are we going to talk about climate change is real? Climate change is not real. Sorry, this presentation is not going to cover that. But I'm just trying to stop and pause and have a momentary reflection to think that, oh, where are we standing yourself? What are your perspectives on this issue? So understanding the positions, privilege of being who I am, what I do is very important in my work. So for me, I start here and go internal on recognizing who I am and where I'm coming from, in order to also understand my perspective and also how do I work with each other and other communities and groups. So when it comes to any particular complex problems like this climate change, we all have the propensity to look at our part of this system, or worse, to consider ourselves outside of the system and to place the blame of the problem of other people. So like this one, climate change is the greatest global health threat facing the world in the 21st century. Most of the medical journal, this is a very huge milestone in the record that we have more than 200 medical or health journals publish the same editorial to say that climate change is a health emergency, it's a health threat. But most of the scientific literature is written in English, and creating alarming knowledge gap, which 75% doesn't speak English and doesn't really know about climate change. That's a very big problem. We can't act on it when we don't know it. So a lot of the cases when people see climate change issues on news happening in their hometown, but they don't know anything about it because it's all reported in English. So a lot of the knowledge gap is up here. People are screaming about climate change, scientists are asking us to reduce our emissions, but in local, no one knows what's happening. What are we going to do? In health as well, we are so good in creating best equipment to diagnose diseases as fast and effective as we can. But we doesn't really know that it's actually a lot of our handprints as all over environmental impact. I'm not sure if you know that if global healthcare sector is a country, it will be the top 5th largest emitter on the planet. If healthcare sector is a country with a vast majority, vast consumptions of energy and also generations of waste, we are one of the largest emitter of the world. Maybe this is a coincidence. Yesterday, July 22, we know that it's an eventful day in the US politics yesterday with numbers of events happening. It's also marked Climate Emergency Day. So 22nd of July is Climate Emergency Day. So you can see on top of this is a climate clock. Yesterday it's 5 years, so today we have only 4 years, 364 days until our deadline. So it's a calculation that how much emissions that we still have the quota to put into the atmosphere. If we're pumping up more faster in a faster space, the 4 years will be even shorter and shorter. While all these political developments often will capture headlines, I don't think the climate clock or the climate emergency day was up on the headlines, getting a lot of attention. But it's very essential not to overlook these very pressing environmental issues that really affecting our planet and our future generations. So here I'll just give you very quick snapshots and how all this connected. We know that climate crisis is increasing. Last week, our Earth average temperature has been more than 1.5 degrees Celsius above the pre-industrialized levels for the past 12 months. So each of the last 13 months was the warmest on record. So nothing is like, oh, this is breaking record, this is breaking record. It's like every day breaking a record. This doesn't mean that we have passed the threshold with the world agreed to in Paris agreements in 2015, but for that to happen, the average of the warming must stay below 1.5. So what this does mean, though, is that we are very much closer to the threshold. We don't have a lot of choices left. The window opportunity to act is getting smaller and smaller. What it also means is that this last year represents a preview what an average year will look like if our global average temperature is above 1.5 degrees Celsius. So sampler, if you will, it's like a taster. You now can feel how will the world look like if the global average temperature is increasing. Over the past 12 months, we have seen a lot of major disasters, from Storm Daniel, which killed at least 6,000 people in Libya, to wildfires in Hawaii, to record-breaking heat across South America in winter, Asia in spring, and the United States right now. So hopefully this is the last bad news or not so good news that I'm going to do in the presentation. It's very hard also to see that the climate crisis is impacting our healthcare. A lot of the intense, frequent climate disasters have disrupted our health services. We have false sense of security that the hospital will be there during flood, but not necessary. There's more and more cases I'll show later. When healthcare can't deliver, patients show up at the hospitals without energy or supplies, we can't deliver or having continued healthcare services. But today I want to focus on the green arrow, which is how healthcare can also help address climate crisis, at the same time also taking care of our public and also the health of our planet. So it's not an option, but do it together. So what is healthcare? In the past, how we are mostly doing just sick care. We look at symptoms, we treat them. That is sick care. But what is the true healthcare? So the questions I keep asking myself, and also my colleagues are working so hard to really shift sick care to healthcare. And what makes a good healthcare for a patient like Roberto? So who's Roberto? I'll give you an example here. So this is a real case. In our medical schools, we are trying to teach our future doctors not only looking at symptoms. This is something that we want to also embed it and incorporate in our co-curriculum. So a case like Roberto, a cisgender, heterosexual black male, 55 years old, live with his wife, mom, and son, a truck driver, diagnosed with grade 3 obesity, hypertension, diabetes, and so forth. So he lives in Brazil, central or mid in the capital state of Mato Grosso, because of the cost of living is higher and higher. So not only working as a truck driver, on the weekends he works at the farm part-time, and is also exposed a lot of pesticides using agrotoxic. So this is a case. So when we look at this case in the lens of climate context or a planetary health point of view, we'll look at this case in a more broader, bigger sense. How all other determinants or environmental factors could actually make him harder to get healthy. And also what kind of opportunity out there that we could also leverage to help protect his health. Can we talk about heat wave? Can we talk about if the culture of eatings change that links to the higher cost of living, the use of pesticides, that is also a link or impacting the environment. So in WHO, we have frameworks to look at how a good healthcare looks like. So these are some of the components, including essential medical products, technology, health workforce, leadership, governance, health information systems, service delivery, and financing. So these are all the building blocks that we believe that is very important, essential components to make up a good healthcare. But eventually, when you look at this photo, it's kind of contradicting that this is not a good healthcare. So this is a real case. In Australia here, in 2019, 2020, the Australian bushfire, we also see hospitals suffered. Unable to deal with the levels of smoke, unhealthy levels inside the buildings, and also other medical equipments are failed to function. So it's not so climate change doesn't really respect the borders. It just cross over. They don't need passport. So you also see cascading effects. One thing happen in one country will also impact the healthcare sector system in another area. So not only cascading effects that is much more intense and frequent, we also see longer impact. So after the flood, maybe we're expecting 3-5 days, the hospital will continue working, start delivering services. But right now we are seeing a lot of the disasters making the healthcare sector hard to bounce back. And it's taking much more longer time to be able. So on top of that, we still have also political unrest, conflicts that is targeting hospitals. In Japan, so new policies that urge hospitals to enhance their disaster preparedness, especially during heat wave. In the past, there's no laws or regulations, but right now they urge that hospitals at least 3 days that you have to prepare for energy. So in the States, we do have contingency plans. What do you need to do during emergency or disasters? But there's a lot of questions that why aren't these plans working when we need them to? Can we pull out the binder and see what's the SOP or things that we need to do? But because of climate change, the uncertainty and the unpredictable changes, making healthcare sector hard to prepare or anticipate those impact and changes. So, breathe. Everybody is trying to be very serious at the moment. It's kind of scary. Sometimes people don't know that the healthcare sector, sometimes we thought they will be there to take care of us when we need them. But still, they are also one of the very vulnerable infrastructure for us. So, let me see. And in the past, in the medical world, we are really centered on the knowledge of experts. We do prescriptions procedure based on journal A, B, C, and D to tell us what to do. So most of the time will be standardized treatment or responses. We have a traditional way of knowing and formation of those studies that we are always looking for more evidence, and everyone in the world will be doing the same. But in climate change context, there's no cookie cuttings. Impacts or vulnerability from each context is different. We need to incorporate some of the different knowledges or forms of knowing, or traditional healers or ways of protecting health. But sometimes it's contradicting biomedical model and also the traditional healing approaches. So how do we bridge those two? What are the solutions might fit? How can we start even the conversation? Planetary Health offer a framework to tell us that climate change is only one system or one sign that showing the whole Earth system are operating. So we have the ecological ceiling, then that is compartmented into 9 different planetary boundaries. And we have also a social foundations that we have to take care of all the 8 billion people currently and beyond. So planetary health framework offer this safe and just for humanity operating space for us to work with. So how do we combine and bridge the both perspective? International hospital federations have policy that we need to address climate change as an integrated part of healthcare delivery. So not only looking after our people or public, we also need to look after our planet. Some evidence that shows that health infrastructures are ill prepared, from the Lancet of 2017. Another repeated studies are looking at 2018, also not so good news that our adaptations were within the healthcare is increasing. So what or why this is happening? From my PhD research, I look at all the initiatives and frameworks that is helping supporting hospitals to address climate change. We do have multiple initiatives and different type of frameworks. And we have a lot of hospital accreditations. every diseases, every department. And we have a lot of network. But what is the problem? From my observation and analysis, when I'm working with this hospital network, we find a lot of duplications. This department will be doing this part, that department doing that part, and a lot of confusion. What do you mean by sustainable? What do you mean by addressing climate change? How do we reduce emissions? And a lot of fragmented. So this part taking care of very small little part, we have data or evidence and research to tell us how much carbon emissions of each cataract surgery, how much carbon emissions of each Caesar's gauze procedures, the environmental performance of each of everything. But combined, how does it make sense in the context and how do they help us make decisions? I know I sound very nerdy, but of course I need to appreciate all the team and amazing partners that I have to work in this area. So these are the organizations and partners that I work with, and internally my team, my research team. So ranging from WHO, research institutes, NGOs, different networks of interest, and also some funding bodies. So some are users, some are decision and policymaker at the national level, some are local communities who are the end users, oftentimes the affected community. My journey started actually in 2015 in Paris COP. So that marks a first involvement or engagement from healthcare in the climate negotiation space. My role was sustainability coordinator for a healthcare system which has 6 to 7 hospitals. So the hospitals are very committed to sustainability and thought that we could be a leader, trying to do something good and make sure that inspire other people to follow as well. This is one of the activity in the hospital. So all the clinicians are invited to participate in these sorting and recycling activities. And they were surprised, most of them, and say, oh, why there's so many of the ways that we have generated. Then you can see these are clean plastics that they can separate during those sorting. And these clean plastics then transform into blankets that is distributed in disasters. Clinicians felt that when they are taking care of the planet, they feel more satisfied. A lot of the colleagues are telling me that they are very stressed seeing all this mounting a vast amount of waste generated in each procedure or operation. But participating in this kind of activities helps them say that, oh, I'm grounded in this, then I can also contribute to the community. This is another project that we look at energy use and also different type of interventions that makes and help policymakers that what kind of intervention is better for you. So looking at more than 120 hospitals. Each hospital has different climate research, climate impacts, and also serving different groups of people. The trauma center are more in high intensity, energy intensity type of procedures, so they are using much more energy. Or hospitals that are close to equator, their temperature, extreme temperature are much, days are higher. So with research or data, we could try to understand what kind of interventions or strategy will be good or a good fit for your hospitals. It doesn't need to still try and error or investing a lot of money and just wait and see if it's working. But there's a lot of evidence out there to help us guide us with our decisions. So with that, a lot of the case studies or good practices are spread and shared within the network of the international health promoting hospitals and health services. So this is a network with 800 hospitals and across 40 countries. So these global partnerships subscribe to the idea that hospitals are not only taking care of the people, but also the planet. So they have accreditation standards that encourage and support the hospitals to reduce their energy consumptions and also their waste. So in the generational partnership, here maybe you have some students or next generation, it's always gives me a lot of hopes working with our younger generations. So I'm also part of the Australian Medical Student Associations. Every year they will have activities. Students or young people feel very confident when they have agency to change. They know about climate change impact. It feels very depressed when they can't do something about it. And there's a lot of fear when people are just fighting in each other but not doing anything. So this kind of activity help provide opportunity and platform for young people to create something that is solving the problem. So for this example, they have this greening hospital hackathon that conducted in a weekend, and students will come up with ideas that how we could make our hospital more green. This is an example that they created like a trolley so that the waste could be segregated on the spot. Another group of amazing people, the Women's Leader for Planetary Health, it's also link all the researchers or early career professionals who are interested in this field. So we call ourselves the Planetary Health Tribe. It's a very helpful platform for me because I feel like when you're working in this field, it's such a daunting, overwhelming area. But working with them side by side, it's really charging. So I really encourage find your own tribe, people who you trust and work together. And this is a great opportunity and platform. And another one, I think this is a very new and interesting network. It started last year, put together by the Executive Director of AWIA, Dr. Bryce Wakefield. He has this idea of this is a wicked problem of disaster or climate change resilience. How can we look at things differently? So these 15 people are chosen representing different countries, field, discipline, or even areas of work, but working on the same topic, disaster resilience. We are very privileged to be the first inaugural member cohort, and the second cohort now is in Japan. So we were tasked to research on disaster resilience from our discipline as well as working with other people from other disciplines. They put us in Japan, Australia, Fiji, and Tonga. We talk to and interact with disaster survivors, policymakers, academics, and visit a lot of disaster museums or affected areas. So this is a very fortunate opportunity that you hear firsthand, look firsthand with the people who are suffering or impacted by climate change or disasters, and what are their needs and perspective on this issue. We often are so siloed working in our desks that we can't see the differences or the nuances. And this just opened my eyes that I get to go to the NHK Japan to look at, they did a drill like a tsunami early warning system. So for me, as in health or public health, I don't know if this is, if I don't have this opportunity, how can I have this experience, look at this area. So it does give us a lot of different perspective and discussions among us, 15 of us. So we are still doing our final analysis and research, and hopefully the paper or manuscript will be coming out soon. So this is an Australian funded project in Conexi, DFED funded project. So I'm the principal investigator of this project. What we are trying to do is linking data, so climate change, disaster, and health data for hospitals, especially primary healthcare in the 3 cities in Indonesia. So we chose coastal city, Aceh, Mataram, and Maluku. So these 3 cities, they have Puskesmas that coordinated with us. So if you're interested, I can also demonstrate the data and how we have those data to inform our program, how all this data can help us understand where is the at-risk populations. If this month will be maybe projected having high precipitations, floods, or possibly dengue outbreak, how are we going to plan our health services in anticipating all these different impacts? This project is a collaboration with the WHO Nepal, first of its kind, to look at 3 different ecological regions in Nepal. So we have the Himalaya, we have the Hili, and also the Terai. 3 very different climate change risks and impacts. At the Himalaya area, they started to see dengue, the climate-sensitive diseases outbreak. Before that, there wasn't many cases, but right now we started to see. Then the Terai region, floods, food security issue, and the Hili regions are facing droughts, water scarcity problem. So these 3 hospitals are our partner hospitals, and these are some pictures that during my visits and fieldwork. So this is a hospital. The red line was the previous flood line. They uplifted, moved the generator above the flood line. But the question is it tall or high enough for the next disaster? So oftentimes, we do know that we need to change, but is the change good enough? That we don't know. So this is another innovations in one of the hospital in Nepal. As I said, the water scarcity problem, hospital often have waterborne diseases and outbreaks. So hospital there have these innovative solutions that we don't want to just wait for people to get sick to come into hospital. How can hospital also play a role in contributing, providing safe, affordable water? So this is the water ATM. So ATM is not just getting money, but getting water. And this picture is the food storage thing, which is also above that they can also stand for flood. So these are all the local knowledges that they incorporate, which is cultural sensitive, and it's also appropriate in addressing the health of the people as well as the health of the planet. For them, it's very different when you talk about climate change. You don't need to convince them if it's a real thing. They will tell you how they feel about climate change. When you go there, they will just asking you, what can we do? So this is a picture in the discussion. They faced power shortage during these discussions, but still the discussion is still continuing. So sometimes it's very different feeling vibes when you talk about climate change in different contexts. Like you say, 90% of the nursing staff join capacity building to learn about climate change and how they could also talk about climate change with their patients. When it's hot, we don't prescribe patients to go out for physical activity or exercise. Last 5 minutes. These are just flip through some other strategy, medical or nurse-led puskesmas or clinics that you could also exchange your services using plastic bottles. PPE that is made from umbrella materials that is waterproof and also reusable. This is a Health in Harmony project that is looking at illegal logging in Indonesia. 2 ways or 2 very important issues, complex. Illegal logging in carbon-rich tropical forests is harming the planet. At the same time, this community is facing low access to healthcare. So how can we combine both? So by collaborating with the community, if you are telling us that where's the illegal logging activities happening, we could give you a green credit that you could exchange health services. So with this combining both, addressing both issues, the people will receive discounts up to 70%. And this results in 70% of reduction of deforestation and save more than 6,000 acres of rainforest. So partnership can come in many forms. Now research or a lot of attempts also looking at how we work with other species, plants, animals. This is a picture in Aceh. I just came back last month. This year is the 20-year commemorations of the Indian Sea tsunami, and they have a special exhibitions on acknowledging the contribution of elephants during disaster recovery. So there's more and more learnings, and this is to conclude, I guess, 3 points again. Move beyond awareness towards specific and measurable actions that the partnership can take. Be specific about what you want the partnership to do and focus on one goal behavior at a time. And it's just perspective that understand why people are doing the behavior you're trying to change or work with them towards finding a solutions. Like this illustrated, still I need, I can. So how we move and merge them together. Last story I will tell. This is a project in Cambodia-Vietnam border. That's a lot of people crossing the border to seek healthcare in Vietnam. This is a very epiphany moment for me. When I work in disaster for so many years, all I can see just floods. This is disaster. For them, in the local context, they are very happy for this to happen. They say, this is flourishing because it restores our biodiversity. We can have boats, we have wet markets. So is it flooding or flourishing? It really depends on the perspective. Climate change, is it real or is it not real? It also depends on the perspective. But most importantly, how can we move forward in a goal that is good for everyone and also people beyond us. So last, I guess, by shifting from the enemy is out there syndrome to I am, as we are disinvolved, really acknowledging our shared humanity. So shift of perspective is crucial for developing effective, sustainable solutions, and it really needs to benefit for all, as this will be my last. Thank you very much for your attention.
Thank you, Dr. Khan.
Thank you.
It's a lot to take, isn't it?
Sorry.
No, very interesting. I think we always heard one side or the other, but bringing it practically to see how health is suffering because of certain changes. And yes, we could be talking about fossil fuels and other things, but you need a generator, you need a lot of things to make sure that things happen properly. But pollution brought up very beautifully that pollution is something that we need to take care of, and the recycling of plastics. I think before any questions, anyone to ask any questions, please go ahead and this. We got another 10 minutes of question answers. And anyone want to ask? Can't be too silent, guys. Tell us something while people are thinking about it.
Yes.
When you're talking about going into, because I know someone who's keen on Nepal, you talked about the 3 areas in Nepal, and what's your thinking on the people there in terms of the changes and how are they associating to the health air that is being provided in Nepal? They acknowledge the climate change. There's also health disaster because they have a lot of earthquakes and the landslides and everything. So how do they relate to the two, and what do they think as Nepalese people? Because you talked about 3 hospitals, so I'm...
Thank you. Oh, Nepali people are the friendliest people. Like, I know.
Oh, there's one guy here.
Who did I say that?
I'm listening here.
I guess the cultural and the part really help. And they are seeing the frequent intensity and the seriousness of disaster, especially all the earthquake happening. And also on top of that, you have all the political chaos as well. The healthcare part is still very much struggling. There's a lot of resource and supports coming in, I can say, but it's a really good way that WHO has started with Nepal. It's a good research site, I can say, because you have 3 different ecological regions. If it's successful, you could upscale this learning into a lot of people that could learn from this. So that's reasons why they started with Nepal.
You're able to collect a lot of data to be able to duplicate that globally?
Hopefully.
Hopefully, okay.
But that's no cookies cutting as well, so it's also need to be translated into more cultural and local appropriate.
Thank you, Ingrid.
Thank you very much, Connie, for a fantastic presentation. It's very interesting to hear about the relationship between healthcare system and climate crisis. I guess this is something that is not very outspoken about. And I think it's been very fascinating to look at all these different case studies that you presented from different regions. My question is more in relation on how we can make use of all this local knowledge to develop this like more global agenda that is focused on addressing climate crisis with the healthcare system. How, like, I don't know if you have any reflections of that, because I guess most of the biggest problems about having global agendas is that it's very either too general, like generalizing things.
Yeah.
So like, I don't know whether you have some reflections on how we can actually make, build this gap that you were explaining about the local and the global knowledge.
$1 million question.
That's why I said some reflections, because I know there's no one answer, but I would love to hear, like,
Yes. I've been reflecting a lot about those networks and global partnerships that I'm being part with. I think that's a good opportunity when someone like you giving me this opportunity to talk, and all these different stories are being broadcast and being shared. So that's one way. An example with also different people have different heads here. So you will have your sphere of influence, not necessarily straight up to the global international arena, but how you be one step at a time that is influencing the decisions that is going to that direction. But like what you're saying, so we don't want to be too generic of one size fit all type of approach, but we don't want to be too overwhelmed that people don't know what is the next step. So how all these come together.
Just a leading question on that thought. You talked about Indonesia,
Yes.
about these green credits for people exchanging.
Yes.
It's interesting to see plastic bottles being given for healthcare. And then you talked about people dobbing in on other people who are illegally logging to come back to, how does it really work? I mean, I know Indonesia, people, these are all coal production countries, and illegal logging and green. And do people get any repercussions of coming and telling that somebody is logging wood there? How does that work practically on the ground?
Yeah, in principle, it sounds like a good thing, right? But is it safe for people to do so? And also, are we also encouraging people to use more plastic to get exchange for the health services? So that's another problem. Of course, we want to be mindful that we're not having one problem and we're getting into another. But what is the balance to start with? So to what extent that we go to, to give quality healthcare, but also making sure that we are not encouraging people to use more plastics or putting them in a very harmful situation. But of course, I can't go into details. How do we troubleshoot all the different things, and how can other mechanism or processes help to make sure that this is not happening? It's a lot.
That's interesting problem too,
Yes, that is true, to be honest.
Because to me, always people talk about energy, you're destroying coal-fired power plants and moving to electric cars. But on this end, there's a real, very interesting topic to actually think through. has a lot of issues that we need to work together. Any more questions from anyone, please?
I was just wondering about data sets for Australia. We've done a lot of land clearing. We do now have a lot of bushfires. We do now have longer droughts. I'm just wondering, the data sets for Australia, you know, just even here in Queensland, are they there to show that that direct impact from climate change into everyday life, I suppose you could say? You know, those types of drawing that, because as I say, you know, land quality, air quality, especially after fires and that type of stuff. So is there a data set that sort of says or shows something like that?
Like the rate or associations that climate attributed to those changes of
Yeah.
land quality and degradation. I believe I could refer you to other colleagues who are working in that area. I could point you to. I know that there's a lot of different GIS system, like mapping system, to help see the changes. It's real, but yes, I could point you to another colleague who work in that area.
Please.
Yes.
You talked about the importance of getting people to acknowledge and acknowledging ourselves, the importance of shared humanity. I suppose, how would you get someone to appreciate that? So if like the CEO of BP was in the room right now, how would you frame a narrative to actually get like the decision makers and people making a significant impact to come around on these issues where we see historically, you know, people choose money over lives?
Yeah, great question. So that's what the health community is trying to do, putting forward a health argument on the climate change debates and negotiations or discourse. In the past, we don't have anything about health, but we know that health is so near and dear to everybody's heart. When there's a surgery that needs energy, if that's your loved ones, you won't debate, do I need the surgery or not? Do the best. So the health community, the healthcare professionals are now marching forward very fiercely to say that this is not just a climate emergency, it's also a health emergency. So having the health narrative, we think it's very efficient and effective sometimes to go beyond just profit or carbon for those numbers.
Thank you. Anyone else?
I guess my last question would be, with your involvement in all these local programs, and I know that some of them are funded by the Australian government, is this like a knowledge sharing? So by this, I mean, is the Australian government also looking at these cases to learn from them? Or is it more like we're transmitting our knowledge and technology to the local knowledge kind of? So it's like a two-way, transfer of knowledge, or is it more coming from, the Western perspective, developed country just trying to come and help you doing solve the issues?
In my involvement in Connexi, I feel like that's very clear that we don't want to go that part, that we're just coming in to tell you what you need to do, but also vice versa. Like I'm also learning from you because you have more knowledge and experience with disaster and just very nearby with this impact. So we could also learn from each other. But of course, like how do we go beyond tokenistic to really implement it? I feel we still need to put in a lot of efforts in it. Yeah.
All right. Thank you,
Thank
Dr. Conningham. And I think we are having our co-counselor to talk about other things and give for thanks.
Thank you, Dr. Connie, for your wonderful presentation. I believe we all learned something new now, thanks to you. Also, this is definitely a topic that should be way more spoken about in the international agenda. I don't think, like usually it's normal to either hear about healthcare systems or just climate change. This intersection is quite interesting. Okay, so now I'm gonna do a few announcements about the AIIA. We have a lot of upcoming events on the following months. First of all, next week on the 30th, we're gonna have Dr. Scott Waldron from the University of Queensland talking about the third-party plenum, China's economic trajectory and what it means for Australia. Then next month in August, we have two wonderful events. First, on the 13th, we have UK politics from chaos to calmer waters. That's going to be a very interesting one. And then on the 20th, we're going to have international migration and Australia house crisis. Is there anything behind the hype? So I hope you guys can make time for attending more of our events. And once again, thank you, Dr. Connie, for your wonderful presentation.